injuries are inevitable.
Kids will be kids and, things will happen.
Many minor scrapes and cuts can be taken care of at home.
Keep the area clean and dry, soap and water, and if you start to see that there's an increased amount of redness or oozing or signs of worsening signs of infection where it's getting hotter, then I'd say that it's time to seek some medical care.
For minor sprains like rolling an ankle, you'll want to use the Rice method.
You're going to want to rest the injured limb to prevent further progression. You want to put some ice to help with the local swelling and therefore also the pain that comes from that swelling. Compression helps for the same reasons, and elevation to help minimize the degree of pooling of that fluid to help minimize the long-term swelling.
One of the biggest preventative measures that Dr. Alexander Ortega preaches is the importance of helmets.
There's certain things that you cannot really put ice on and prevent the swelling of, and the brain is one of those things. So anything that helps to prevent the transmission of that force into the brain, i.e. a helmet, is certainly a very important component of safety.
When in doubt, Dr. Ortega says seeking medical attention is always a good idea.
If you're concerned that it might be a fracture or it might not be a fracture, it's better to err on the side of assuming there is and being told there isn't, and then you can apply the conservative measures.
Golisano Children's Hospital has a pediatric emergency department open 24/7. For Lee Health, I'm Devin Turk.